Okay, so picture this for a second. What if your spinal cord was literally being stretched, pulled tight, causing this whole cascade of strange and often painful symptoms? It sounds like something out of science fiction, right? Well, it's a very real condition called tethered cord syndrome, and its story is frankly way more complex than most people realize. Let's dig in and unravel this medical mystery together.
For decades, if you heard the words tethered cord syndrome, or TCS, you'd immediately think of kids. It was just considered a pediatric issue, something a child was born with. But as we're finding out, that's really only half the story.
So, the big question is this just some rare problem that only affects children? I mean, that's been the common wisdom for a long time. But the latest research, it's painting a completely different picture. And here's the real twist in the plot. In recent years, more and more adults are being diagnosed. And for them, TCS is a totally different beast. It's a medical mystery that often hides behind symptoms you'd blame on much more common problems. This brings us to a really fascinating point. Even though we use the same name, tethered cord syndrome is basically two distinct syndromes rolled into one. The way it shows up in a child is just vastly different from how an adult experiences it. All right, this slide really gets to the heart of it. Take a look. For adults, the top symptoms are completely invisible. We're talking urinary issues and just this debilitating pain in the back and legs. But then you look at kids, and it's a whole different ballgame. The clues are often right there on the surface. Things like a little tuft of hair or a dimple on their lower back. This distinction is absolutely crucial because it means doctors are hunting for two completely different sets of clues. And wow, this chart just drives that point home. Over 40% of adult patients report back pain. Compare that to a tiny fraction of kids, just 7.5%. This isn't just a number on a chart. It's a story of years of potential misdiagnoses, of people being told they just have a bad back when the real problem is something much, much deeper. The why behind it all is different too. Kids are usually born with it, that's what doctors call primary TCS, but in adults it's often secondary, which means something else triggered it later in life. In fact, almost a third of adult cases are caused by scar tissue from a previous spinal surgery. It's kind of like a rope that got tangled and now it's pulling everything too tight. So if the symptoms are so different and they can mimic all these other conditions, how on earth do doctors even find it? Well, this is where we get into the really big challenges of diagnosing TCS, especially when you're looking at an adult patient. The main tool for diagnosis, the go-to, is the MRI. What doctors are looking for is a telltale sign. The very end of the spinal cord, which is called the conus medullaris, is sitting lower than it should be. It's a pretty clear indicator that the cord is being pulled down. But, and this is a big but, it gets complicated. Get this. Over a third, 35.1%, of adult patients who have clear symptoms of tethered cord syndrome have an MRI that looks, well, perfectly normal. Their spinal cord is right where you'd expect it to be. So the most important takeaway here is that a normal MRI doesn't automatically rule out the condition, which you can imagine makes getting a diagnosis incredibly difficult. And this diagnostic headache is where the science gets a little fuzzy. See, when researchers talk about strength of evidence, they're basically grading how reliable a tool is. For MRIs in diagnosing TCS, the evidence is rated as just moderate. That means, yeah, it's our best tool, but it is not a slam dunk. It leaves a ton of room for interpretation. And that's why this condition can be so frustrating for both doctors and patients. All of this uncertainty naturally leads to a really tough conversation about treatment. The main option is a surgery called a tethered cord release. But for everyone involved, it's like walking a tightrope. You have to carefully balance the potential risks against the potential rewards. Okay, let's look at the risks first. This chart shows that adults unfortunately face a higher rate of complications from the surgery compared to kids. The most common issue is a cerebrospinal fluid leak. That affects about 6.5% of adult patients. And while most surgeries go just fine, the risk of a new or even a worsened neurological problem is a very real thing to consider. But here's the flip side of that coin. Despite those higher risks, the potential reward is also much greater for adults. An incredible 2/3 of adult patients report that their symptoms actually improved after surgery. That's a significantly higher rate of improvement than we see in kids. So you see the dilemma, right? It's a fascinating and difficult trade-off. So what's the big picture here? What does all this tell us?
Well, it shows that our whole understanding of tethered cord syndrome is going through this major shift. We're moving away from thinking of it as one simple condition and realizing it's a whole complex spectrum of issues.
And this quote from a recent, really comprehensive review just sums it all up perfectly. Researchers are basically saying, hey, we've learned a lot, but there are still huge gaps in our knowledge. They're calling for a new wave of better, more rigorous studies to help us finally answer the tough questions about who to treat and when and how.
And really, that's what it all comes down to, right? The future of treating TCS. We now know this isn't a one-size-fits-all problem, so the real challenge moving forward isn't just about understanding the syndrome better, it's about figuring out what personalized treatment actually looks like for each individual. Is it going to be new surgical techniques, maybe targeted therapies, or something we haven't even dreamed up yet? That's the question that's going to define the next chapter in the story of tethered cord syndrome.